helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm Katie Wilson. Today we've got Dr. Nestor Dans with St. Mary's Medical Center. Thanks for being here.
Thank you.
Yeah, and you're a first timer, so very exciting. We always love to have people on the show. We appreciate your time, and I know you are new to St. Mary's, but not new to the area. So let's hear a little bit about yourself.
Yeah, I used to practice in Charleston about 8 or 9 years ago. I was there for about 10 years. And then subsequently left to practice in Florida and then Detroit.
Oh, wow. Okay. So your biggest interest is minimally invasive surgery. So first of all, let's talk about what exactly that means.
So for heart surgery, it means doing the operation through smaller incisions to allow patients to recover a little bit quicker. And the trend in surgery in general for the past 25 years has been to go towards smaller incisions, and heart surgery has been sort of the last bastion to get there. And part of that has been that just the surgeries are more difficult in a sense, and there's more at stake because it's really life-threatening kind of surgeries that we're dealing with every day.
Right.
So it's become harder and harder to have heart surgery adapt to minimally invasive techniques. But there have been a few pioneers that have stuck with it over the past 10 to 15 years. And now it's become more and more mainstream to do minimally invasive surgery.
Great. So what kinds of operations are we talking about?
So our most routine surgeries like valve replacements, specifically aortic valve or mitral valve replacements or repairs can be done minimally invasively. And then some patients that need coronary bypass surgery for coronary artery disease can be done minimally invasively.
Okay, so we're talking about minimally invasive. You would think that that's kind of the preferred method, correct? Like, what are the advantages versus the disadvantages?
Yeah, I think for patients, the biggest advantage of this is a little bit decrease in the amount of healing time and getting back to full activity a little bit faster. So traditionally, open heart surgery is done through an incision through the center of the chest, what's called the sternum. And a lot of patients are just afraid of that incision. It's kind of scary sounding, actually. Yeah. But to do it through smaller incisions, we do it through usually the right side of the chest, and we can get in between the ribs without spreading the ribs too widely. And then we can connect the patient to the heart-lung machine through a small incision that attaches to the artery and vein in the groin. So that's really the difference. So it makes it a little bit harder for the surgeon because you have a little bit smaller area to work in, but you can do the same type of procedure and just as well through the minimally invasive approach once you sort of get up to speed and get used to it.
Okay, so it sounds like there are times where minimally invasive surgeries just aren't possible.
Yeah, there are patients that are not ideal for it. And so we screen everyone prior to surgery to decide who's a good candidate for it or not. So things that require combined procedures, like if you were doing a valve operation and they also needed bypass surgery, is not ideal for minimally invasive. That's better done through the traditional approach because it gives you access to all parts of the heart. And then some patients that are way too ill, probably not a good candidate for it because it takes a little bit longer to do things in a minimally invasive fashion. So we do screen patients ahead of time and decide whether or not they're good candidates for it.
Okay, interesting. And you were saying earlier, for cardiovascular surgeries, minimally invasive surgeries haven't been around for too long. So I'm assuming, you're one of few doctors who does that in our area.
I don't know at this time, but probably so.
Yeah.
And part of it is because I'm coming from elsewhere where it's a little bit more routine and more common. And I was in practice in Detroit, and our center was actually known for minimally invasive valve surgery. Okay,
interesting. So if somebody, down the road may have to have a surgery like this, is that something where a doctor would refer them to you?
Yeah, usually it's a cardiologist refers a patient, or sometimes an internist or a general practitioner refers the patient for evaluation.
Okay. All right. Well, doctor, anything else you want to let our viewers know before we go?
I'm happy to be back in West Virginia. So
absolutely. And when did you come back?
3 weeks ago.
3 weeks ago? Yeah. I had no idea. Okay, awesome. Well, welcome back. So glad to have you here. I'm glad our viewers got to learn a little bit more about what you do. And again, you guys can watch this on WSAZ.com. Just click on the Moms Everyday tab. Have a great day.